If you've broken your femur recently and had surgery and you've lost hope, you're going to have a lot more of it by the end of this, and I promise you, you're going to be okay. My femur broke in a brutal way, and within 22 days I was walking unassisted, and by day 29 I got rid of my crutches. The number one exercise that I believe made my recovery so quick was reverse walking. Even before my femur fracture, I've always said that reverse walking is the most important exercise a human could do every day. I swear by this exercise to get people out of lower body pain and drastically rehab their bodies. Before my injury, I was using daily reverse sled pulls and reverse walking to heal years of service-related knee pain and ankle pain that I was dealing with. Nothing in my life ever worked to get myself out of pain until I tried reverse walking and ATG principles. It's highly likely your physical therapist isn't going to have you reverse walk or isn't going to suggest it, and that's exactly why I believe that most people are not off of their crutches for 3 to 5 months on most injuries like this. Your life and recovery are in your hands, and it's not on your physical therapist to do these things for you, and most of the time they're not going to help you very well. Now, if you are not cleared to load your leg or your doctor did not tell you to, this does not apply to you. If you've had the type of surgery to where your surgeon is recommending that you start to load your leg immediately, then loading your leg is exactly what you should be focusing on, and there's no better way to do that than reverse walking. Loading your leg as quick as you can and walking normally is important for your body to adapt to having an equal weight distribution again, so you can return to a normal gait, which is your body's ability to walk without a limp. I believe reverse walking is the major reason I was able to restore my body's normal gait quickly. If you're especially within the first 2 weeks of your femur surgery, reverse walking is the exact thing I would tell you to focus on more than anything else. If you've broken your femur, get a mindset that it's going to be hard and there's going to be pain every single day for months. Despite having all of the abilities I do now and as quickly as I do, I still have pain every single day. I'm going to show you how to reverse walk with some items that you're going to get after your femur fracture, or maybe that you already have these medical items around if you're struggling with mobility already from a previous injury or pain that you're in. And if you don't have this medical equipment or don't have access to it for any reason, I'm going to give you other ways that you can start reverse walking with items that you'll find around your house. The walker, this is where I started and where you're probably going to start too. This is what I would recommend, even being athletic, in good shape, and being able to function on my own well. I would highly recommend the walker, especially for the first 2 weeks before you get your staples and stitches out. Loading your leg is going to be the most important part of your first 2 weeks. It's going to set the tone for your bone to adapt to your movement as well as reforming and healing better. At my 3-month checkup, my bone was reforming and healing very well and almost ahead of schedule, and my surgeon credits a lot of that to all of the relentless loading I did on my leg. You have to load your leg, especially if they're telling you to load your leg. You need to do that to get ahead of your recovery. The walker is a very stable and safe option for forward and backwards walking at any level with or without a femur break. Using the walker to take the weight off of your leg, you just want to be able to step and do what you can. And this is how I started. Just tiny steps. Step first, then bring the walker. Taking all the weight off, as much as you can handle, bearing that weight, and using the walker to do the rest. This is very stable. I'm not scared at all about falling backwards. The same thing with the forward. And then eventually I was getting a little bit faster. How's that for 2? So I stayed on the walker for the first 2 weeks, and the day that I got my staples and stitches removed, I went immediately to my crutches once I got home and went to the gym to PT after I'd been cleared to. So now we'll get rid of the walker and we'll migrate to the crutches. Now, when I went to the gym that first day, I used 2 crutches and pretty quickly got off of 2 and went to 1. So this is how I would approach reverse walking with crutches, and what really worked well for me. I like to step with the crutch first, step with my feet second. Plant that base with the crutch, come back on that bad leg, and try to start walking backwards on it. And again, we're taking all that weight off here on the crutch, trying to bear what we can. And there we are. Same thing forward. Step with the crutch, step with your feet. Step with the crutch, step with your feet. So after a couple laps of doing that, I didn't spend much more time with 2 crutches and pretty much just went down to the 1. When walking with 1 crutch, it's going to be the same thing that applies to walking with 2. We're going to step with the crutch first, plant a base, and then step with the foot. So step with the crutch, plant the base, step with the foot, and bear that weight into your opposite hand of the femur. So we step with the crutch, step with the foot, brace with the arm, and go. eventually you start to get a little bit better with it. Becomes a little bit more smooth. So after doing that every day, after day 14, by day 22, I was ready to drop the crutch to my side and start to take my first steps unassisted. And that's what I did. And then like 7 days later, I was ready to drop the crutches and start to actually really start to load my leg, which is what I think really started to help. So if you don't have access to this medical equipment for any reason, or if you're somebody who's dealing with knee pain, or you personally want to start reverse walking and don't have very good mobility, you could probably start with something like a rolling chair if you have one at your house that's on wheels. What I would do is I would put the chair out in front of me, kind of put a little bit of weight into it, not enough that you're gonna fall over or tip the chair, but this should provide you with enough. And I would just try to walk backwards so you have a little bit of a counterbalance going forward so you don't feel like you're going to fall backwards. So I would just do that personally, like this. So if that's not an option or doesn't really work well for you, you could maybe try a broom and treat it like a walking stick. Whatever side of your body hurts the most that you need weight off, put the broom on the other side. So let's say for me, in my case, left leg is what's hurt, left leg is what had surgery. So I'm going to put the broom on my right side. And just like with the single crutch, the same thing would apply to the broom. You step with the broom, build your base, step with your foot, brace with your arm, and step backwards. And just keep repeating that. Now, if that didn't work too well, or you need more weight off of the foot and can't do it on one side, try grabbing the broom with two hands, putting it out in front of you, and then on this one, you step with your foot, and then the other foot, and then re-brace and re-center here. And then you're just doing this. And that's even actually a lot more sturdy than doing it with a single hand. Now maybe none of those options work for you, but another one that you can consider is using your countertop. I actually love this method, and this is what I'm actually suggesting to my grandmother and some people in my family to start doing around their house. It's as simple as this, really. There is a way to get started on every exercise no matter where you're at. You just have to understand how to scale the exercise and use little tools like this that you can find around your house or from somebody who's maybe gone through a surgical procedure or some kind of medical procedure. Your health and recovery from injury are in your hands. I've given you some tools here to try to start to help yourself going forward if anything like this ever happens to you, or you experience knee pain or any type of immobility throughout your life. I really hope this can help you, and thanks for watching. Subscribe for more.